So my name's Alastair. I'm a GP up in Wellington, among other things. I'm also on the board of Coeliac New Zealand and on the research strategy board of Coeliac UK. And today I am speaking about the health journey with celiac over your years and thriving with confidence at every stage of that journey. So I actually want to start at your 100th birthday. And I want us to all imagine our 100th birthday. So your family's all around you, you're healthy, you're sharp, you're here. And the reason for that is because you were diagnosed and because you did something about it. And that's the premise of this talk. Everything I'm going to share today is how we get from wherever you are now to that moment. So what does that 100th birthday look like for you? Let me paint a picture. Your bones are strong because you caught the osteopenia early, supplemented vitamin D, and reversed it. Your cancer risk is no different from anyone else's because after years on a strict gluten-free diet, that small increased risk of cancer has returned to baseline. You took control of your diet decades earlier than many people ever do, and that awareness carried into a lifetime of better choices. You had a career that wasn't derailed by brain fog, unexplained fatigue, and days lost to symptoms that no one could explain. And perhaps you had children and grandchildren you might never have had, because undiagnosed celiac disease is one of the treatable causes of infertility and recurrent miscarriage. But you were diagnosed, and it was treated. You were here at 100 because of that, and because you did something about it. So how do we get there? Some of you may have been diagnosed last month, some of you last year, some of you 5 or 10 years in. This is a talk about the journey wherever you are now to that 100th birthday. So I see it as 3 chapters. Day 0, what diagnosis feels like and what matters most. Year 1, finding your feet and realizing that celiac disease is bigger than the gut. And then the long game, what the evidence really says about your future, and kind of threaded through that, how to build this partnership with the health system, knowing that it might not be handed to you and you may have to make that happen. So, day 0. For many people, diagnosis brings a genuine relief. Finally, an explanation after years of being told it's IBS or stress or anxiety. But then that can shift. I finally know what's wrong gives way to I have a chronic lifelong condition. So grief, frustration, overwhelm, all of these are valid experiences. The medical system will focus on a lot of box ticking at this stage, so blood tests, bone density, vaccination stuff, dietitian referrals, avoiding gluten, and these boxes matter. But what the system doesn't do well is help you figure out how to actually live with this. What matters most right now is giving yourself permission to not have it all figured out. So join Coeliac New Zealand. We exist for a reason for that in this moment. Get the dietitian referral. It's not optional. It's the single most important practical step. And start learning, because the next year will teach you more than any pamphlet can. So year 1. The good news is that most people will start to feel dramatically better within weeks on a gluten-free diet. Energy returns, brain fog lifts, gut symptoms settle. But the reality is that learning to live gluten-free is a skill, and you will make mistakes. Persistent symptoms are often due to accidental gluten exposure in sauces, marinades, shared toasters, restaurant kitchens. It can be a minefield, and that's okay. It gets easier, but it takes time, and the learning curve is steeper than a lot of people expect. So to give you an example, I spent years not understanding why every time I came back to visit family in New Zealand, I felt so unwell. I felt bloated, I was irritable. I genuinely thought it was, coming back into the family home that I was having conflict with my parents and things like that. But what it turned out I was doing was I would arrive in the country, Auckland Airport, straight to the Corridor Lounge, to the gluten-free toaster with the gluten-free bread, prepare it, put Marmite on. Because I was diagnosed in Abu Dhabi where they didn't have Marmite, so nobody thought to tell me that this was a gluten-containing food. And it wasn't until years down the line when I brought some Marmite back for a celiac friend in London, he questioned, well, why are you bringing me this thing that we can't eat? Like, what's going on here? And the reason why I mentioned this is because this was something that nobody thought to tell me because of where I was living at that stage. Marmite didn't exist, and gluten can hide in places you don't expect. So it's these things that catch you out are things that nobody thinks to warn you about. You've got to give yourself some space for getting things wrong. But yeah, celiac disease is not just your gut. So year one is often when you start connecting the dots. Celiac disease is a systemic condition. The immune response to gluten will affect the brain, the nervous system, the bones, the skin. Depression and anxiety is significantly more common, and some of that is the burden of chronic illness, but some of it can be neurological or related to the inflammatory process itself. Brain fog is one of the most commonly reported symptoms, often one of the first to improve on a gluten-free diet. But there are also emerging links to neurodiversity, ADHD symptoms, migraine, peripheral neuropathy. A decent proportion of patients will ultimately develop another autoimmune condition, thyroid disease being one of the more common ones. So the message is this: if you've lived with symptoms you always just assumed were just part of you, that this was just how you were, things that were to do with mood, energy, focus, that first year is often the year to start reevaluating that. So you can talk to your GP about anything that shifted in that year, for better or worse, because this is often the point where other problems become a little bit clearer once you take the fog of celiac disease out of the picture. Okay, so the long game, what the evidence says. Let's get back to that 100th birthday. The evidence does support that we get there. So cancer risk moderately elevated at diagnosis, about 11% above the baseline. That's back to normal within 5 years on a gluten-free diet. Bone density will typically improve and often normalizes on a gluten-free diet, vitamin D supplementation and monitoring. Fertility normalizes once diagnosed and treated. Undiagnosed celiac disease being a treatable cause of infertility and adverse pregnancy outcomes. Stroke risk returns to normal 5 years on a gluten-free diet. Dementia, there's no increased risk at all actually with that one, so we can cross that off the list with things to worry about. Heart disease, interestingly, this is from the UK Biobank data, 27% increased risk thought to be driven by chronic inflammation, or perhaps aspects of the gluten-free diet, with it being a lower fiber content at times, maybe contributing to that. And this one doesn't clearly resolve on the gluten-free diet, so the standard heart-healthy strategies are important. The pattern is generally pretty clear, though, that most celiac-specific risks are pretty modest, and many resolve with time and adherence to a gluten-free diet. But I do want to put this in a bit of perspective, because I think a few faces there, when I say 27% increased risk of cardiovascular disease, that sounds concerning. Let's put it in the context of some of the other lifestyle factors, things like smoking, alcohol, obesity, inactivity. When you're looking at a 15 to 30 times risk of lung cancer with smoking, they're not even in the same ballpark. The increase of colorectal cancer with inactivity can be, at least 20% kind of thing. It's a similar kind of increase in risk from something like that. So the core point of this slide is that your main risks to your health are not celiac disease. It's the standard things that get everyone else. So these are the things you do need to focus on. Don't ignore the celiac disease, don't ignore the effect of the gluten, but know that the standard lifestyle things that create most of the disease burden in the modern world are the main things to be considering for your health long term. Those are the things that will have the biggest impact. Now, I will say that celiac disease does mean that you get a little bit of a head start in thinking about things like your diet, thinking about things like your lifestyle, perhaps having to cook things for yourself that otherwise you may have got the processed option. So there is a potential benefit to getting that head start. So let's talk about eating smarter gluten-free. So the gluten-free diet does have trade-offs that you're often not warned about. Rice-heavy diets will accumulate arsenic. So a 2024 study found a 5-fold increase in arsenic levels in children on a gluten-free diet after just 6 months. Packaged gluten-free foods are often more processed than their wheat equivalents, higher in sugar and fat, lower in fiber and protein, and the gut microbiome does take a hit. Lower fiber means reduced microbial diversity. Now, the answer is not to eat gluten, it's to eat smarter gluten-free. So you want to diversify your grains, the quinoa, the buckwheat, the millet, the amaranth, the teff, the sorghum. You want to cook from scratch more often. Try to eat a variety of plant-based foods because this will feed the microbiome. And go back to your dietitian It's one more reason why the referral shouldn't be a one-off. Okay, so an honest take on building that relationship with your GP. So, as a GP, let me say this directly: the system is underfunded, overworked, under real pressure. You may not see the same doctor twice, and the era of the family doctor who knew everything about you is largely gone. No one is proposing anything that's going to bring that back. You might be frustrated with your GP. I can almost guarantee you they're more frustrated than you are with the system. For whatever reason they went into medicine, it probably had something to do with helping people, and now they're working inside a system that makes that harder and harder each year. So if you walk into that consult angry, wanting to argue, wanting to prove a point, you may be completely justified, don't get me wrong, but it's not necessarily going to result in better care for you. The goal here isn't being right. The goal here is managing and improving your health. So what I would say matters now is continuity with your health data, not necessarily continuity with a specific doctor. If your record is complete and up to date, you can change GPs or change clinics without losing ground. Coming in, that's the modern reality, and that's how to make it work in your favor. And coming in knowing what you need, so annual blood tests, cardiovascular risk stuff, bone density at diagnosis, repeated if abnormal, vaccination review, because celiac disease is associated with functional hypersplenism, so the spleen works a little bit less good at taking out encapsulated organisms like the pneumococcal and meningococcal bugs. Dietitian re-referral at life transitions like pregnancy, adolescence, travel, and considering the Pharmac Special Authority for gluten-free food subsidies as limited as that is. So if you go in with this information written on a piece of paper to your GP, hand it to them, you'll be amazed how much easier that review appointment can be for the both of you. So I mentioned this earlier, the idea of the forced advantage, that I like to reframe it in this sort of way, that being diagnosed with celiac means that you're forced to think about your health at an age where most of your peers are not. You're forced to read labels, you're forced to understand ingredients, you're forced to cook from scratch, engage with the health system, do regular blood tests, know your bone density, know your vitamin levels. Most people never have that degree of understanding of their health. And you have a reason to show up. You have a reason to show up for health checks that many people never get. And I don't think that's nothing. I think that that's a significant long-term health advantage if it's played correctly. And you're not doing it alone. You've got Coeliac in New Zealand, you've got your GP and practice nurse, you've got the dietitians, but actually you've also got the celiac community in general. So everyone in this room can help each other out on this. So if we go back to the idea of your 100th birthday, so we were diagnosed, we adjusted, we learned, we showed up. Maybe we even made it easier for our GP. We kept our bloods in check, we ate well, not perfectly, but we ate well. Lived a full life, perhaps with children, career, energy, strong bones, clear head. Celiac disease, lifelong condition, but the life that you get to live after diagnosis can also be long, and that's the main point that I'm trying to make here. And I'd say the future is getting brighter. There are potential treatments that could go alongside the gluten-free diet in development, and hopefully in the next decade there's a realistic prospect that there may be some adjunct therapies that reduce that burden of accidental exposure. So the gluten-free diet itself may not go away, but it may get easier.